Have you ever looked at your feet and thought nothing about them? Just another part of the body that carries you through the day? Most people don't pay attention to their feet unless there is pain, swelling, or an injury. But what if I told you your feet can actually warn you about a serious health problem long before you feel sick, long before doctors diagnose it, and sometimes even years before you realize something is wrong? Today we are talking about something extremely important, especially for seniors, adults over 40, and anyone who wants to stay healthy as they age. Your feet can show early warning signs of diabetes, and many people ignore these signs until the condition becomes dangerous. Diabetes is not just about sugar levels. It affects your nerves, your blood circulation, your skin, and even your ability to heal. And one of the first places where these changes appear is in your feet. In this video, we will go through 9 warning signs in your feet that could mean diabetes. Some of these signs look small, some feel harmless, but together, they can reveal what your body is trying to tell you. Let's start with the first warning sign, and this is something many people feel but ignore, and that is tingling or burning in the feet. You may feel like your feet are buzzing, prickling, or even slightly electric, especially at night when you lie down. Some people describe it as pins and needles, while others say it feels like their feet are on fire. This happens because high blood sugar can damage the nerves over time. Doctors call this diabetic neuropathy, and it often starts in the feet before moving to the legs or hands. The reason it starts in the feet is because the nerves there are long and more sensitive to damage. At first, the feeling may come and go. You might think you slept wrong, or maybe your shoes are too tight. But when the tingling keeps coming back, especially without a clear reason, it may be your body warning you that your blood sugar is affecting your nerves. Another sign many people notice is numbness in the feet. This one is even more dangerous because you may not feel pain when you should. Imagine stepping on something sharp and not realizing it. Imagine having a cut or blister and not feeling it. When nerves are damaged by diabetes, the brain stops receiving signals from the feet. This numbness can start slowly, just a little loss of feeling, and then get worse over time. Seniors often think numb feet are just part of aging, but that is not always true. Loss of sensation can be a serious sign that blood sugar levels have been high for too long. When you cannot feel your feet properly, small injuries can turn into infections without you noticing. And this is one of the reasons diabetes can become so dangerous if ignored. The third warning sign is dry, cracked skin on the feet. Now, many people have dry skin, especially in winter, but diabetic dry skin is different. It often becomes very rough, very tight, and may crack easily, especially around the heels. High blood sugar affects the body's ability to keep skin healthy. It also reduces sweating in the feet, which makes the skin lose moisture. When the skin becomes too dry, it can split open, and these cracks can allow bacteria to enter. For someone with diabetes, even a small crack can lead to infection because healing becomes slower. If you notice that no matter how much lotion you use, your feet stay very dry or start cracking often, it may be time to check your blood sugar and talk to a doctor. Another sign that many people overlook is slow healing cuts or sores on the feet. This is one of the most important warning signs. Normally, if you get a small cut, your body starts healing right away. But with diabetes, high sugar in the blood damages blood vessels and reduces circulation. When blood flow is poor, oxygen and nutrients cannot reach the skin properly, so healing becomes slow. You may notice a blister that takes weeks to heal, or a small wound that just stays there. Some people even notice dark spots or sores that don't go away. This is not something to ignore. Slow healing is one of the clearest signs that diabetes may be affecting your body, especially if it keeps happening. Now here's another sign that surprises many people, and that is swelling in the feet or ankles. Swelling can happen for many reasons, but when it happens often, especially together with other symptoms, it can be related to diabetes. Poor circulation and nerve damage can cause fluid to build up in the lower part of the body. You may notice your shoes feel tighter, or your socks leave deep marks on your skin. Sometimes the swelling is worse at the end of the day. This happens because blood vessels are not working the way they should. Diabetes can affect the heart, kidneys, and circulation, and the feet are often the first place where swelling becomes visible. The next warning sign is changes in skin color on the feet. Healthy skin usually has a normal tone, but when blood circulation is affected, the color can change. Some people notice their feet look pale, others see redness, and some may even see a bluish or purplish color. This happens because blood is not flowing properly to the skin. When tissues do not get enough oxygen, the color changes. In diabetes, damaged blood vessels make it harder for blood to reach the feet, and this can cause these unusual colors. If your feet often look different from the rest of your body, especially when you are resting or lying down, it may be a sign that circulation is not normal. Another sign you should never ignore is frequent foot infections. This includes fungal infections, athlete's foot, or infections around the nails. High blood sugar creates a perfect environment for bacteria and fungus to grow. The immune system also becomes weaker, so the body cannot fight infections as easily. Some people notice their toenails become thick, yellow, or brittle. Others get itching, redness, or peeling skin that keeps coming back. When infections keep returning even after treatment, it can be a sign that blood sugar is not under control. This is why doctors often check the feet carefully in people who have diabetes or are at risk for it. Let's talk about another warning sign that many seniors experience, and that is pain in the feet when walking. This pain may feel like cramping, aching, or heaviness, especially after walking for a short time. Some people feel better when they sit down and rest. This can be a sign of poor circulation, which is common in diabetes. When blood vessels become narrow or damaged, muscles do not get enough oxygen during movement. The result is pain or weakness. Many people think this is just aging or lack of exercise, but it can also be a sign that blood sugar has been affecting the blood vessels for a long time. The ninth warning sign is something very small but very important, and that is loss of hair on the toes or feet. Most people never think about hair on their feet, but it can tell a lot about circulation. Hair grows where blood flow is healthy. When circulation becomes poor, hair may stop growing or fall out. If you notice that your toes look smoother than before, or hair is disappearing from your feet, it may be because blood is not reaching the skin the way it should. This is often seen in people with long-term diabetes, or people who have had high blood sugar for years without knowing it. What makes these signs so important is that many people feel them long before they are diagnosed with diabetes. Sometimes the body gives warnings for months or even years. The problem is that most people ignore these signs because they seem small. A little tingling, a little dryness, a small cut, a bit of swelling. It does not feel serious at first. But diabetes often develops slowly, and the earlier you notice the signs, the better chance you have to control it and avoid complications. Taking care of your feet is not just about comfort, it is about protecting your health. Simple habits can make a big difference. Checking your feet every day, keeping the skin clean and moisturized, wearing comfortable shoes, and paying attention to any changes can help you notice problems early. If you ever see sores that do not heal, feel numbness, or notice strange colors in your feet, it is important to get your blood sugar checked. Many people discover diabetes only after nerve damage has already started, and by then it becomes harder to reverse. Another thing many people do not realize is that controlling blood sugar can actually prevent these problems from getting worse. Healthy eating, regular walking, staying active, and following medical advice can protect your nerves and blood vessels. The feet often show the damage first, but they also show improvement when health gets better. People who take care of their blood sugar often notice that tingling becomes less, skin becomes healthier, and wounds heal faster. For seniors, this is especially important because the risk of diabetes increases with age. The body becomes less sensitive to insulin, and lifestyle habits from earlier years start to show their effects. That is why paying attention to small signs can protect you from bigger problems later. Your feet carry you every day, and sometimes they speak before the rest of the body does. Learning to notice these signals can help you stay independent, active, and healthy for many more years. Many doctors say that if people check their feet as often as they check their face in the mirror, diabetes complications would be much less common. It only takes a few seconds to look, but those few seconds can save you from serious problems in the future. Your body is always sending messages, and your feet are one of the clearest places where those messages appear. So if you notice tingling, numbness, dry skin, slow healing, swelling, color changes, infections, pain when walking, or loss of hair on your feet, do not ignore it. These signs do not always mean diabetes, but they are signals that your body needs attention. The sooner you check, the better your chances of staying healthy and avoiding long-term damage. Many people wish they had noticed these signs earlier, because early action can make a huge difference in how the rest of your life feels. Another warning sign that many people do not think is serious at first is foot cramps at night without any clear reason. You may be lying in bed, trying to sleep, and suddenly your foot tightens, the muscles pull hard, and the pain wakes you up. Sometimes the toes curl, sometimes the arch of the foot feels like it is twisting, and sometimes the cramp moves up toward the calf. It can last a few seconds or even a few minutes, but the discomfort can stay much longer. Many people think this happens because of getting older, or maybe because they walk too much during the day. But when these cramps happen again and again, especially without a clear cause, it may be your body giving an early warning sign that something deeper is happening. And one possible reason can be changes related to diabetes. Night cramps are very common in adults over 40, and even more common in seniors. The reason they often happen at night is because the muscles relax during sleep, and any problem with nerves, blood flow, or mineral balance becomes more noticeable. In people who are developing diabetes or already have high blood sugar, the nerves that control the muscles can slowly become damaged. When nerves do not send signals properly, muscles can tighten suddenly without warning. This is why the cramp feels like it comes out of nowhere. One moment your foot feels normal, and the next moment it feels locked, stiff, and painful. High blood sugar can affect the body in ways many people do not realize. It does not only affect energy levels or thirst. Over time, too much sugar in the blood can damage small blood vessels and tiny nerves, especially in the feet. The feet are far from the heart, and they depend on healthy circulation to stay strong. When circulation becomes weaker, the muscles may not get enough oxygen and nutrients, and this makes them more likely to cramp. At night, when blood flow naturally slows down, the muscles can react by tightening suddenly, causing those painful cramps that wake you up from sleep. Some people notice that these cramps start happening only once in a while, maybe once every few weeks. They do not think much about it. Then it starts happening more often, maybe once a week, then several times a week. Eventually it becomes part of the night routine. You go to sleep, expecting that your foot might cramp at any moment. This slow change is exactly how many diabetes-related symptoms begin. They do not appear all at once. They build slowly, so slowly that it is easy to ignore them until they become impossible to ignore. Another reason diabetes can cause foot cramps at night is nerve irritation. When blood sugar stays high for a long time, it can damage the protective covering around nerves. This makes the nerves more sensitive and less stable. Instead of sending smooth, normal signals to the muscles, the nerves may send sudden signals that make the muscles contract too hard. This is why the cramp feels so strong and difficult to control. You may try to stretch your foot, stand up, or massage the muscle, but the tightness does not go away immediately. It feels like the muscle has a mind of its own. Many seniors think cramps are just part of aging, but aging alone does not always cause severe or frequent cramps. When cramps happen often, especially in the feet and lower legs, it is important to look at other possible causes. Diabetes is one of the most common hidden causes, especially in people who do not know their blood sugar is high. Some people live with prediabetes for years without knowing it, and during that time, the body may already be showing signs like night cramps, tingling, or numbness in the feet. Another thing that can make cramps worse in people with diabetes is dehydration. When blood sugar is high, the body tries to remove extra sugar through urine. This makes you urinate more often, and when you lose too much fluid, the muscles can become more likely to cramp. Dehydration also affects the balance of minerals in the body, such as potassium and magnesium, which are very important for normal muscle movement. When these minerals are not balanced, muscles may tighten suddenly, especially at night when the body is resting. Some people notice that their cramps happen more after eating sweets or heavy meals late in the evening. This can be a clue that blood sugar levels are rising during the night. When sugar levels go up and down quickly, the nerves and muscles can react in strange ways. The body tries to adjust, but the changes can cause discomfort. And one of the ways this discomfort appears is through muscle cramps in the feet or legs. Foot cramps can also be connected to poor circulation, which is another problem that often happens with diabetes. Healthy blood vessels carry oxygen to the muscles, helping them relax and contract normally. When blood vessels become narrow or damaged, the muscles may not get enough oxygen, and this can cause sudden tightening. Some people notice that their feet feel cold at night, and then cramps start soon after. Cold feet and cramps together can be a sign that circulation is not as strong as it should be. Another important detail many people notice is that the cramps often happen when the foot is in a certain position, like when the toes point downward during sleep. In healthy muscles, this position does not cause a problem, but when nerves are irritated or circulation is weak, the muscles may react by cramping. This is why some people wake up suddenly with their toes curled and their foot stiff. The muscle tightens without warning, and the pain can be strong enough to make you jump out of bed. People who are developing diabetes may also notice that stretching helps for a moment, but the cramps keep coming back on other nights. This repeating pattern is important. Occasional cramps can happen to anyone, but frequent cramps without a clear reason should never be ignored. The body usually does not create symptoms for no reason. When something keeps happening again and again, it means the body is trying to tell you that something inside needs attention. Another thing to watch for is when foot cramps come together with other small changes. Maybe your feet also feel numb sometimes, or you notice dry skin, or small cuts that take longer to heal. Each sign alone may not seem serious, but when several signs appear together, the chance of diabetes becomes higher. The body often gives many small warnings instead of one big warning, and people who notice these small changes early have a better chance of preventing serious problems later. Sleep can also be affected by these cramps, and poor sleep can make blood sugar harder to control. When you wake up many times during the night because of pain, the body feels more stress. Stress hormones can raise blood sugar levels, which can make nerve problems worse, and this can lead to more cramps. It becomes a cycle that keeps repeating, and many people do not realize that the problem started with changes in blood sugar. Some people try to ignore night cramps by drinking more water, changing shoes, or using home remedies. These things may help a little, but if the real cause is related to blood sugar or nerve damage, the cramps will keep coming back. This is why it is important to look at the bigger picture instead of only treating the cramp itself. The foot may be where the pain happens, but the cause can be inside the body. Doctors often say that the feet can show signs of diabetes earlier than many other parts of the body. Because the nerves in the feet are long and delicate, they are often the first to react when blood sugar stays high. This is why symptoms like tingling, burning, numbness, and cramps often start in the feet before moving to the legs or hands. Paying attention to these early signs can help people find problems before they become serious. Another reason night cramps should not be ignored is that they can increase the risk of falling. When a cramp wakes you up suddenly, you may jump out of bed to stretch the muscle. If your balance is not strong, this can lead to slipping or falling, especially for seniors. Diabetes can also affect balance by damaging nerves in the feet, so the combination of nerve weakness and sudden cramps can be dangerous if not taken seriously. People who control their blood sugar often notice that cramps become less frequent. When circulation improves and nerves become more stable, the muscles can relax normally again. This does not always happen overnight, but the body can recover when it gets the care it needs. Healthy eating, regular movement, and checking blood sugar levels can make a big difference in how the feet feel, especially at night. It is also helpful to pay attention to when the cramps happen. If they come mostly at night, mostly in the feet, and keep returning without a clear reason, it is a good idea to have a medical checkup. Many people discover high blood sugar only after symptoms like these appear. Finding the problem early can prevent nerve damage from getting worse and can protect the feet from more serious complications in the future. Your feet carry you every day, and they often speak quietly before the rest of the body shows any signs. Night cramps may seem small, but they can be one of those quiet signals. When muscles tighten without warning, when sleep keeps getting interrupted, and when the same pain keeps coming back again and again, it may be your body asking for attention in the only way it can. Listening to these signals early can help you stay active, stay independent, and avoid problems that become harder to fix later. Another warning sign that many people do not connect with diabetes at first is loss of balance while walking due to weak foot nerves. You may notice that you are not walking as steady as before. Maybe you feel slightly unbalanced when you stand up, or you feel unsure when walking on uneven ground. Some people say it feels like the floor is not completely stable, while others feel like their feet are not responding the way they used to. This change can happen slowly, so slowly that you may not realize it at first. You might think it is just aging, or maybe you believe your legs are getting weaker. But sometimes the real reason can be nerve damage caused by high blood sugar. The nerves in your feet play a very important role in keeping your balance. Every time you stand, walk, or turn, tiny nerves in your feet send signals to your brain. These signals tell your brain where your feet are, how much pressure you are putting on the ground, and how your body should adjust to stay stable. When these nerves are healthy, you do not even think about balance. Your body does it automatically. But when these nerves become weak or damaged, the brain does not get clear signals, and that is when balance problems begin. In people who have diabetes or are developing diabetes, high blood sugar can slowly damage the nerves, especially in the feet. Doctors call this nerve damage neuropathy, and it often starts in the toes and moves upward. At first, the damage may be very small. You may only notice a little tingling or numbness. Later, the nerves may stop working properly, and this can make it harder for your brain to know exactly how your feet are touching the ground. When the brain does not get accurate information, your body cannot adjust quickly, and this can make you feel unsteady while walking. Many seniors think that losing balance is just part of getting older, but that is not always true. While aging can affect strength and reflexes, nerve damage from diabetes can make balance much worse. Some people notice they need to hold on to furniture when walking around the house. Others feel nervous when going up or down stairs. Some may even avoid walking outside because they feel afraid of falling. These changes often happen slowly, and because they happen little by little, people get used to them and do not realize that something is wrong. One reason balance problems happen with diabetes is because the nerves in the feet are very long and very sensitive. These nerves need good blood flow and healthy tissue to work properly. When blood sugar stays high for a long time, it can damage the small blood vessels that feed the nerves. Without enough oxygen and nutrients, the nerves become weak. When nerves become weak, they cannot send clear messages to the brain, and the body loses some of its natural ability to stay steady. Another thing that can happen is loss of feeling in the bottom of the feet. You may still be able to walk, but you cannot feel the ground the way you used to. It may feel like you are walking on a soft surface even when the floor is hard. Some people describe it as walking with thick socks on all the time. This loss of feeling makes it harder for the body to react quickly when you step on something uneven. Normally, your nerves tell your muscles to adjust right away, but when the nerves are weak, the reaction becomes slow, and this can cause you to stumble or lose balance. Balance problems can also become worse in the dark. Many people with nerve damage notice that they feel more unsteady at night or in low light. This happens because when you cannot see clearly, your body depends more on the nerves in your feet to stay balanced. If those nerves are not working well, the brain has less information to use, and walking becomes harder. This is why some people feel fine during the day, but feel unsure when walking in the evening. Loss of balance can also be connected to muscle weakness in the feet. When nerves are damaged, the muscles they control may become weaker over time. The small muscles in the feet help keep your body stable when you stand or walk. If these muscles do not work properly, the foot may not move the way it should. This can change the way you walk and make you feel less steady. You may notice shorter steps, slower walking, or feeling tired after standing for a long time. Another important reason to take balance problems seriously is the risk of falling. Falls can be very dangerous, especially for seniors. A simple fall can cause fractures, joint injuries, or long recovery times. When diabetes affects the nerves in the feet, the risk of falling becomes higher because the body cannot react as quickly to keep balance. Even small slips can become more serious when the nerves are weak. Some people also notice that balance problems come together with other foot symptoms. You may feel numbness, tingling, burning, or cramps, along with unsteady walking. When several of these signs appear at the same time, it can be a strong signal that the nerves are under stress. Many people ignore these signs because they are not painful, but nerve damage does not always cause pain. Sometimes the biggest warning sign is simply that the body does not move the way it used to. Checking your blood sugar is very important if you notice changes in balance that do not have a clear reason. Many people find out they have diabetes only after nerve symptoms start.